Okay, here I am. Um, wow, I think it's, let's see, August 6th, I had my um, skin removal surgery. And August 6th, okay, September, October, November, December, January, February. So I'm about 6 months post upper body lift and arm lift, upper thigh lift, variety of things. And I'm not here to talk about that. What I'm here to talk about is how does the gastric sleeve work and what does it feel like? And is it still working? And that type of thing. So I had a nice lady, Katie, ask me um, a bit about it. And it's hard to say. I give her the clinical answer. Makes your stomach smaller, decreases hunger. Um, but I was eating a sandwich and I wanted to share with everybody. I'm now a year and a half, not quite a year and a half, post gastric sleeve. And I had the gastric sleeve like August, I think August 2nd, I'm sorry, October 2nd, 2011. We've gone past the 1 year anniversary, 2012. And I did have the skin removal surgery before my 1st year anniversary, which most people don't do. But I am an impatient person, and it corresponded with my coworkers' holidays and my husband's time off and a variety of other things that kind of all work together. So the gastric sleeve, which I had, uh, I'm going to give you an example of how it works. So here's a piece of bread. I just had two of those pieces of bread, about 3 slices of deli ham and some grated cheese on, and made a sandwich, kind of a grilled cheese, only with ham. And I ate it, and now this kind of inspired me to answer Katie's question, is now I'm so full that I sort of had to, I was laying down watching TV and I just was just groaning full, like such pressure. And almost, I felt my mouth water a little bit. Uh, Sometimes that's a pre-warning that I'm going to be sick, that whatever I ate is going to want to come back up. But this far along, um, generally, I don't just throw up. At times, I have to admit that sometimes I eat too much, and it's not because I'm necessarily in love with the food. It's more often that I'm distracted or I just plain forget that I can't eat a whole sandwich. And it's still hard to believe that I probably, half would have made me full. Half a sandwich would have made me full, but I would have felt okay full. There have been times where I've ate too much and I'm in such pain that I have um, made myself throw up because I'm so uncomfortable. And obviously this isn't behavior that people should do on a regular basis, and I don't. But that's how uncomfortable you are with a small amount of food. And I ate this sandwich probably 40 minutes ago, and I really feel uncomfortable still. And the same would happen if I had a normal portion of food like everybody else. Like if I had a homemade hamburger, I would be very uncomfortable. And I'm not talking about with the lettuce and all the trimmings, just the meat and the bun, and I am very uncomfortable. Uh, sometimes I'm gonna say sometimes I'm undisciplined, but I would say a lot of the times I'm undisciplined. And by undisciplined, I mean that I'm not focusing on eating, and I forget that I'm not a person that can eat that much at once. Half of a sandwich, half of a hamburger, and I'm full. Now, that's what it's like having um, the gastric sleeve. The flip side of this, there's always the good and the bad. I'm not saying this is the bad, but one thing that you seem to be able to do is eat certain foods that aren't good for you, and you don't feel like I feel right now. To give you an example, over the course of a couple hours, I ate um, where am I here? A whole package of Ritz crackers. Now that's like giving cocaine to a drug addict. Like I happened across them. I have to admit, I was looking for something to eat, because I was anxious and I was just didn't know what to do with myself. And so I ate a whole tube of Ritz crackers. I'm actually burping now. I'm sorry. Um, and I didn't feel as uncomfortable as I do now. Uh, so there's certain foods that you need to be um, aware of that you may still be able to eat in excess. Um, there's certain foods I can eat, and I would say for some reason popcorn's one of them, and popcorn's how I won't say it's how I got fat because there's a lot of factors that went into it, but eating popcorn at night was certainly a huge contributor, and I can still eat popcorn, and it's strange because it's a high fiber food, but I'm not sure. I guess it's puffed up when you eat it, and when it hits your digestive system, it shrinks or something. So there's some foods that you can definitely still eat, and you can gain weight if you're that undisciplined, I guess. And I don't mean disciplined like iron of will. I mean just sloppy for the most part. And not drinking with meals is another important thing so that you can get enough nutrition in. I haven't been that careful about getting enough protein. I'm very lazy when it comes to food. I'll admit most of the first year I had protein shakes and a little bit of whatever my husband was making for supper. And I still start the day with a NutriBar, which is about 280 calories and lots of protein. And that kind of ties me over. Um, and I do have coffee with skim milk and an artificial sweetener. And I have equivalent of about 6 cups, like cup measures, between 6 in the morning and 11 o'clock in the morning. Lunch, I've been having peanut butter and jelly sandwich, but I can't eat the whole sandwich at once, so I sometimes eat half at 10 and half at 12:30, something like that. And I might have yogurt, um, not at the same time. I can have an apple. Apples really fill me up. And trying to think what else that you may want to know. Other people are very different than me, and so they probably have better eating habits. I would hope they're not worse. Um, but I'm very busy, and the last thing I want to think about is food too much, and I'm also wary that I don't get back into my old behavior where I was counting calories and counting points and all that crap, because the more I think about food, the more I eat. And so if I get some bit better routines around the food, some automatic meals that are better than what I have right now, although I'm not that worried about the peanut butter sandwich. And like I said, for supper, I'll eat a small portion, and by small, I mean like well, I don't know if that makes much sense from your distance, but um, 3 ounces maximum of meat, and maybe a few spoonfuls of corn or a couple spoonfuls, and I mean tablespoons of potato or something. So there you have it. That's how it works. Um, I did eat and nibble chocolates over Christmas. I have been craving food because I basically stress myself out by allowing things into my life that make me too busy. And when I came home from my skin removal surgery, before I had the skin removal surgery, I was like 154. Had the skin removal surgery. I was a month later, I was 144. I actually saw the scale go down to 142. Right now, I'm hovering between 146 and 148 in that neighborhood. And I'd like to be less. I'm finding that the weight gain is more noticeable. I mean, the smaller you are, the more you notice a smaller amount of food. So being just under 5'4", I would like to get under 140. Um, my only issues is I'll do this. Or I have this. Um, my forearms are still a little bit chubby. Um, then take skin off the forearms or fat or whatever, and so they're a little bit chubbier than proportionately the rest of my arm is. And my calves are the same way. There's some pull-up boots that just won't go over my calf, and I've been irritated by that my whole life. So um, as a treat to myself, I will lose a little bit, get under 140, and kind of not have the chubby forearms and calves. I think my face got a little bit puffier too. It doesn't take much weight gain. The smaller you are, like I said, it's noticeable. So that's all I wanted to say about how the sleeve works. I mean, basically, you can't eat as much, and that's that's a permanent condition, and different foods fill you up differently, and so you got to not have the foods in your house that you're able to eat in excess. And unfortunately, they're usually um, refined carbs. Uh, so you just can't eat them. You do fall into bad habits because you didn't get where you are without ingraining bad habits your whole life. And so I will report back maybe in a month about this particular topic of what it's like to have the gastric sleeve. Ciao. Hi, YouTubers. Pat here. I am 6 months post facelift and eye lift surgery. Um, August 3rd and 6th or something. No. It was a week apart. Beginning of August and the second week in August with Dr. Rosenstock and Dr. Cohen in Costa Rica. And that's San Jose, Costa Rica. So I got that done in August, and it's now February. So I thought I'd come on here, and people who are interested in surgery above the shoulders, I'll just show you a little bit about what things look like now, 6 months post. I also had a nose job. My nose wasn't a problem, but I just thought I'd make it nicer. That's fun. I also had silicone injections in my lips, and so my lips are just a little bit fuller. I think they don't look that different from the front, but I think from the side um, they're less severe in the profile, and that was kind of what I was going for. I didn't want to look sort of harsh from the side. So I am not wearing any makeup. So I thought I'd let you have a close look. I am wearing a bathing suit in case you think I'm wearing really low cut stuff, because I'm going to update also on some other procedures I had done at the same time. And so here goes. The facelift, all here was numb forever, all on the side here. I did have a acid peel as well, and that really improved the texture of my skin. I had no idea what it was for, but the guy recommended it, Dr. Rosenstock, and it really is a pretty terrific procedure. It was about $600, but it made a world of difference. So I'm gonna let you see my eyelids. I'm not sure if this video it captures very good quality, but the upper eyelids, I don't know if you can even see. There might be a little tiny bit of redness. And then at the side here, the lower lids, I didn't really have a lot of puffiness, but they pulled it, just tightened it a little bit. So there's a tiny scar there. I don't know if you can see it if I go really close. And occasionally I wear glasses for reading and progressives most of the time. And but my eyes do look a little bit red rimmed. I'm not sure if they do today in this probably a really crappy video. I did have a brow lift too, and that scar's back here somewhere. I honestly don't think people can see it. It went up here. I don't know. I don't think people can see it at all. And I don't give it a second thought except for, see, they actually cut this way, and I don't know, I guess they lifted my thing and pulled it back and cut off the excess. They also did a little bit of killing some of the nerves that create a big frown line, but I can still do all kinds of movements. So the forehead's been quite itchy, and it's been like, not itchy like it would distract you from doing whatever you're doing, but I do notice it's sort of a little bit itchy. And so then that was the brow lift. Actually, it's easier from this side. The incision line, it comes right down here, right here somewhere. I can feel it, okay? And then when it wrapped around my ear to right here. Oh, there's a little tiny bit here too. Else. Really want to give you a chance to see it if there's any way of seeing it. I'm gonna pull my ear back. And not sure if this is showing up, but that's kind of what you look at. I'm not sure if it's noticeable because I don't have my hair back a whole lot. I had the nose job, and I guess there's a little scar here. They shaved this. I didn't have like a big huge bump, but they shaved this the bone coming down here. They just shaved it so it's just a little bit more of a dip instead of a kind of a fairly severe thing. They rounded the tip off because it kind of came into a point, sort of a sharp edge and then in. And they took off a little bit of fullness here. I know there's a difference, but it's not like I look at former pictures myself and say, wow, that was a big schnoz, because it wasn't. And they do say it takes up to a year to see all the results of rhinoplasty and other facial surgeries, so I'm happy. Yeah, I'm very pleased with it. I think it's just a bit of a softer look, and I did gain about 5 pounds, so I think I gained a little bit on here. And say in my other video, I'm going to be losing maybe 10 pounds before springtime, because my lower legs and forearms are still a little bit chubby. So the facelift is pretty uneventful. I can't say that there was much of a problem there. I did look horrendous, as I said in my video, and wasn't a lot of pain. It just looked bad. I honestly didn't feel much pain, and wasn't that big of a deal. I think it cost, I forget what it cost. It was a little less than 5 grand. There was a variety of things I had done, like I said. The nose, I think, was 2,700, and the eyelids were 1,800 total. The brow lift was, or eyelids, maybe 1,900. The American, the brow lift was 1,800. The nose job, I think I said, did I say 2,700? Okay, and yeah, can't remember all the prices off the top of my head, but they do add up. Definitely. Still paying off the bills, and but happy. Happy I did it. Can't complain. Ask me anything.